Good morning, everyone. Thank you for joining today's webinar. My name's Freddie, and I'm just going to run through a little bit of the housekeeping before I hand you over to our presenter. So today's webinar on ISO 45001 and mental health and wellbeing. If you just make sure that you've got all your browsers closed down in the background so that your internet can work okay. If you just have the volume set up to a nice level, and we will make sure that the slides and the webinar is available to you. You'll probably get that email through next week. If you have any technical issues, if you just want to write a little message in the chat box, and then towards the end of the webinar, we will be doing a Q&A session. So any questions, please pop them into the little box and ask away. So the agenda for today, we're going to go through what is mental health, the impact of mental health on your organisation, why an organisation needs to address staff wellbeing, how to create a well organisation, what is ISO 45001, what are the benefits of 45001, and how can ISO 45001 help you improve wellbeing in the workplace? I'll now hand you over to our presenter, Kate.
Thank you, Freddie. Good morning, everyone. I'm Kate Breslin. I'm the UK Product Manager for Occupational Health and Safety Standards within SGS. I've been with SGS for 9 years now. When I started as a lead auditor for health and safety, quality and environment and various other schemes. Following that, I moved into the product manager role, firstly for National Highway Sector schemes and then for all occupational health and safety management systems. Before joining SGS, I worked in the construction industry, managing environment, quality and health and safety systems from that side of the fence. Next slide, please, Freddie. So this morning we're going to be looking at managing mental health and wellbeing in the workplace. And we can jump on to the next one, please. So all workers are entitled to work in environments where risks to their health and safety are properly controlled. As can be seen in the slide, the statistics do not look good for achieving this, with 1 in 4 having physical health conditions and 1 in 5 of those employees with a physical health condition also having a mental health condition. 1 in 3 current UK employees have long-term health conditions, with 1 in 8 having a mental health condition and 1 in 10 a musculoskeletal condition. 42% of those who have health conditions felt that their condition affected their work. Those employees with mental and physical health comorbidity, and by comorbidity we mean that people who have a disease or a condition also have 1 or more other diseases or conditions, were much more likely to see their health as affecting their work, creating a compound effect. Next slide, please. So there were various things that we as employers need to manage in the workplace in order to help managing mental health and wellbeing. So we need to look at the relationship between pressure and performance. We need to look at why managing mental health actually matters. The common mental health conditions, the impact of mental health conditions on safety, workplace and individual pressures, addressing mental health in the workplace and identifying mental health risk factors. So these are some of the issues that we're going to be looking at and hopefully addressing today for you. Next slide, please. So we've all experienced the negatives and positives of pressure. Too much and you feel like you can't cope. Not enough and you struggle to get anything done. So aiming for that sweet spot, that green section in this graph, where the right pressure equals peak performance and health, and take careful self-management and practice. The pressure performance curve is a management tool that can help. It zones Its zones of comfort and stretch show the path to peak performance, avoiding the dangers of rust out and burnout. So the orange and the red zones there. The pressure performance curve is a bell-shaped curve that charts the relationship between the pressure and the performance. You may also know this curve as the stress curve. They are one and the same, but it's more useful to think of pressure instead of stress, because stress for most people is a negative experience. Strictly speaking, stress can be positive as well, but we're going to use the word pressure instead in order to remove any negative connotations here. Everybody needs a minimum amount of pressure to motivate themselves. If a task is too easy or there are no targets, deadlines, or expectations to meet, then performance is usually poor. We rarely get much done unless we have a goal. Either somebody sets our goal for us or we create them ourselves. Human beings need a sense of purpose in life, just like any other animal does. For hundreds and thousands of years, human survival had been based upon the hunting and gathering of food, finding shelter, seeking a mate, raising a family. And that powerful sense of purpose is hardwired into our genetics. We can't feel good unless we have a purposeful goal. On the other hand, when pressure is too high, performance will decrease. For a while, it will exceed that of the comfort zone, but soon the effects of stress will take over. Fatigue will set in and errors will be made. Stress symptoms will begin to develop. Frustration, anxiety, poor concentration, and shame about not being able to cope will take over, and performance will plummet. So we need to work on this balance. And this is a very personal balance to each and every individual, because what's positive pressure for some will put others into that burnout zone, or others still into that rust out zone. It depends entirely on the individual. Next slide, please, Freddie. So we've mentioned mental health a few times now, and it's been a term that's been used a lot in the news and press over this last year of pandemic and COVID. But what do we actually mean by mental health? Well, the World Health Organization's definition here is actually quite a good one. It states that mental health is not just the absence of a mental disorder. It is defined as a state of well-being in which every individual realises his or her own potential. They can cope with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution to her or his community. So we can see here that mental health isn't necessarily negative again. It can be positive mental health issues. Next slide, please. So when we're talking about poor mental health issues, generally we're talking about stress, depression, or anxiety. Stress is a state of mental or emotional strain or tension resulting from adverse or demanding circumstances. Stress isn't a psychiatric diagnosis, but it is closely linked to your mental health in two important ways. Stress can cause mental health problems and make existing problems worse. For example, if you often struggle to manage feelings of stress, you might then develop a mental health problem, such as anxiety or depression. And secondly, mental health problems can cause stress. You might find coping with the day-to-day symptoms of your mental health problem, as well as potentially needing to manage medication, healthcare appointments or treatments, can become extra sources of stress. Depression, on the other hand, is a mood disorder that causes persistent feelings of sadness or loss of interest. If you're given a diagnosis of depression, you might be told that you have mild, moderate, or severe depression. This describes what sort of impact your symptoms are having on you currently and what sort of treatment you're likely to be offered. You might move between mild, moderate, and severe depression during one episode of depression or across different episodes. There are also some specific types of depression. You've got seasonal affective disorder, commonly known as SAD. This is depression that occurs at a particular time of year or during a particular season. Prenatal depression or postnatal depression, and that's depression that occurs either pre or post pregnancy. Anxiety is a feeling of worry, nervousness, or unease, typically about an imminent event or something that you have an uncertainty about the outcome of. Anxiety can become a mental health problem if it impacts your ability to live life as fully as you want to. So, for example, it may be a problem if your feelings of anxiety are very strong or last for a long time. Your fears or worries are out of proportion to the actual situation. You avoid situations that might cause you to feel anxious. Your worries feel very distressing or are hard to control. You regularly experience symptoms of anxiety, which could include panic attacks. You find it hard to go about your everyday life or to do things that you enjoy. If your symptoms fit a particular set of medical criteria, then you might be diagnosed with a particular anxiety disorder. But it's also possible to experience problems with anxiety without having a specific diagnosis. Next slide, please. Mixed anxiety and depression is the most common mental disorder in Britain, with 7.8% of people meeting criteria for diagnosis. 4 to 10% of people in England will experience depression in their lifetime. Common mental health problems such as depression and anxiety are distributed according to a gradient of economic disadvantage across society. The poorer and more disadvantaged are disproportionately affected by the common mental health problems and their adverse consequences. Mixed anxiety and depression has been estimated to cause 1/5 of days lost from work in Britain, with 1 in 6 adults having a common mental disorder. So you can see here that the prevalence of the common mental health problems is widespread. Next slide, please. And poor mental health has an impact on both individuals and on the workplace. So the impact it can have on individuals, where the individuals are finding it difficult to concentrate, they're taking longer to do tasks, they're putting off challenging work, they're being less patient with their customers or their clients, they're having difficulty making decisions, they're experiencing poorer relationships with others, and they're finding it more difficult to learn new tasks. There may also be physical symptoms, such as disrupted sleep. And this in turn has an impact on the workplace as well. It will impact on their colleagues. There will be a higher level of conflict within the workplace. There will be notably higher sickness absence levels. There will be higher levels of presenteeism, and I'll come on further down the presentation to explain what we mean by presenteeism. There'll be lower productivity, lower morale, lower engagement. It will impact on the customers, and it will impact on the company brand and reputation as well. Next slide, please, Freddie. So the effects of poor mental well-being can be different for every individual. And it can not only affect the psychological health, but also have a detrimental impact on physical health too. Sometimes poor mental health can contribute to difficulties at work, and employees need additional support and input to ensure that they can maintain their mental well-being and performance. And again, these are some more reasons of the implications for health and safety. That feeling of overwhelm or lack of concentration, that feeling of fatigue yet not being able to sleep, that impaired decision making, or impaired memory, feeling irritated and less patient all the time, having a reduced efficiency and selective attention rates. The accident rates have gone up, unusual self-isolation, keeping themselves to themselves, they don't want to bother other people, and a lowering of confidence levels. Next slide, please, Freddie. So I wanted to share some statistics for you. There's plenty of statistics out there for injuries and fatalities in the workplace. But here are some statistics around poor mental health. Poor mental health is the biggest killer of under 35s. It's more deadly than cancer and more deadly than car crashes. So I'm just going to leave this here for a minute and let these facts sink in. Next slide, please. These are just a couple of the times when poor mental health has had disastrous consequences. The German Wings flight 9525, where 150 people died, the pilot was found to be suffering from depression. And Piper Alpha oil rig disaster, where 167 people died. The offshore installation manager's command and decision-making abilities had been severely hampered when his anxiety reaction to the situation that was developing around him kicked in. So he didn't make the decisions that he needed to make at that time. Next slide, please. Mental health issues cost the economy around £45 billion a year. It's estimated that over 17.5 million days were lost to work-related stress, depression and anxiety in the UK. So you can see some statistics here as well, where there's been a 41% rise in mental health problems in the past 12 months. 2/5 of organisations saw an increase in mental health problems in the last 12 months. Less than 50% of employees feel able to talk to their manager. 25% of people are considering resigning due to stress. Work is being considered as being more intense with greater workloads and pressures. And 9 out of 10 people with mental health problems experience stigma and discrimination still within the workplace. Next slide, please. Stress and poor mental health costs your business in the region of £1,300 per employee per year. However, simple health and wellbeing interventions can minimise that cost, generating up to a 9-fold return on investments. There's never been a greater awareness of the negative commercial impact of stress and poor mental health at work. As well as this, there's increasing awareness of the effects of the issues on the lives of the employees, their families, their friends, and their colleagues. A raft of research and reports from internationally recognised organisations have consistently demonstrated the scale of the problem and its impact on the bottom line. However, the evidence suggests that many organisations could still do more to support their staff, with simple solutions that lead to significant returns on investment. So you can see here some figures that can be used in creating the business case within your organisation for managing mental health in the workplace. Next slide, please. Being healthy, living a long, happy life and being satisfied with your lifestyle and a sense of purpose is essential for each person. The key is to look after both your body and your mind. A healthy body can lead to a healthier mental state, while poor physical health can increase the risks of developing mental health issues. Similarly, poor mental health might negatively influence physical health, triggering risks of various mental conditions. While taking care of your health can mean seeking professional help and treatment, it also means taking several steps to improve your wellness on your own. Making these simple changes in your routine will pay off in all aspects of your day-to-day activities. It can help to enhance your mood, build resilience to change, build resilience to challenges or stressful situations, and promote overall enjoyment of life. So here are 10 simple strategies that are believed to improve your physical and mental health. Practicing yoga, eating healthy meals, challenging yourself, going to bed on time, or at least attempting to, being active, keep learning, maintain healthy, thriving relationships, meditate, check in with yourself, and incorporate self-care into your life. Next slide, please. We mentioned presenteeism earlier on, and it's a word that's been dotted around for the last quite a few years now. But what do we actually mean by it? So presenteeism, or working while sick, can cause productivity loss, poor health, exhaustion, and workplace epidemics. While the contrasting subject of absenteeism has historically received excessive attention in the management sciences, presenteeism has only recently been studied. Presenteeism is, at its root, a cultural problem, and as with all cultural problems, fixing presenteeism starts at the top. Senior managers need to stay home when they are sick or unable to attend work for whatever reason, and they need to lead by example. Next slide, please. So when we're looking at managing mental health in our workplace, we're looking at interventions and good practices that protect and promote mental health in the workplace, which can include the implementation and enforcement of health and safety policies and practices, including identification of distress, harmful use of psychoactive substances and illness, and providing the resources needed to manage them. The management of mental health should be an integral part of the organisational culture, and it should be championed from the top. Risk assessments need to be carried out in the same way you would for a physical risk to safety. And you need to decide on the levels of intervention you can work on within your organisation. Next slide, please. So the culture of managing mental health in the workforce needs to be led from the top of the organisation. At the earliest opportunity, you should be engaging with senior management team and building that business case specific to your organisation. You need to know what the current costs are in your organisation that are associated with poor mental health. You need to have a plan as to how you see your organisation dealing with poor mental health and managing mental health within your organisation. And you need to know how you can monitor the improvements of your plan. And you need to work collaboratively with the other departments such as occupational health, human resources. And once you have the buy-in from the senior management team, you'll be able to progress your plans and see the improvements your plans will bring about. It helps to enlist board members or members of your senior management team as your mental health champions, someone who will raise the issue at the highest levels within the business. It may be that they've experienced a mental health problem themselves, or they may simply be passionate about looking after their staff. They can also help to lead by example by encouraging more junior employees to think about their mental well-being at work. Next slide, please. As an employer, you should have a vested interest in the physical and mental well-being of your employees. Companies that implement well-being strategies tend to notice a significant increase in employee productivity levels and a reduction in sickness and absence rates. The most important part of your strategy is the actions you plan to take to improve well-being in your organisation. You need to outline your goals and the steps for each initiative. Other things you could cover in your wellbeing strategy is the type of work environment and management style you would like to promote. Your plan should also include actions for the creation and distribution of wellbeing policies for the employees. These policies need to be clear and in simple language to avoid misunderstanding or confusion. And don't forget to include any costs associated with implementing your wellbeing strategy, as this is often overlooked. But it's important to outline where your resources are going to be used, especially if you're on a tight budget. This will all help in creating a well organisation where you can minimise the negative impact on the company policies. You can promote good leadership styles. You can positively influence working practices and workloads. And you can create an organisational culture that facilitates social justice. Make people feel valued. Offer work flexibility. Ask the question of every organisational change: what impact will it have on staff mental health? Make work meaningful and promote social cohesion and inclusiveness. Next slide, please. There are many reasons why mental health has become such a huge issue in the workplace today. But one factor is that many cases go unrecognised until they become severe. So whilst many employers are now primed to spot signs of physical illness, mental health problems can be more difficult to identify. So here are some common signs that someone might be struggling with mental health at work. Emotionally, employees who are struggling with their mental health may seem irritable, sensitive to criticism, demonstrate an uncharacteristic loss of confidence, or seem to lose their sense of humour. Cognitive, an employee may make more mistakes than usual, have problems making decisions, or not be able to concentrate. Look out for any sudden or unexplained drop in performance at work. Could be behavioural. This could include things like arriving late, not taking lunch breaks, taking unofficial time off, not joining in with the office banter, or not hitting deadlines. They could become more introverted or more extroverted, generally acting out of character for them. It could be physical. Employees who are stressed sometimes exhibit physical symptoms, such as a constant cold, being tired at work, looking like they haven't made an effort with their appearance, or there may be rapid weight loss or gain. At a business level, look out for increased absence or staff turnover. Have you noticed employees working longer hours, or a general drop in motivation or productivity levels? It's important to take action on mental health now. The World Health Organization predicts that depression will be the world's most common illness by 2030, and suggests that the global burden of the condition will be greater than for illnesses such as diabetes, heart disease, or even cancer. To tackle this and avoid the detrimental impact poor mental health has both on employees and on the business, employers must take action to prevent mental health issues occurring, as well as providing support when they do. The reward for getting this right is happier, healthier workforce and more successful, high-performing business. Next slide, please. As an occupational health and safety management system, ISO 45001 can help in managing mental health and wellbeing within your organisation. It's designed to integrate with the other ISO management system standards to create an encompassing certification that not only protects workers from workplace-related injury and ill health, but also helps to ensure provision of a tailored in-house mental health support system. The benefits of considering the health and safety of your workplace go far beyond complying with the legislation and law. Aside from attracting, motivating and retaining staff, there are knock-on benefits for your organisation's productivity, profitability, resilience and customers' loyalty over time as well. It can boost your reputation as an ethical organisation, fitting in well with social corporate responsibility policies. Next slide, please. So, quick question for you all. When you think of occupational health and safety management, do you automatically think of the management of mental health? Or do you think more of physical safety? The majority of people will go for physical safety, although mental health and well-being is within the standard. Next slide, please. So as with all new ISO standards, ISO 45001-2018 has been developed following the Annex SL structure. There's a wide range of management systems, quality, environment, occupational health and safety, etc. But true integration of the system has not always been straightforward, largely because the structure of the standard, the requirements and terms and definitions were not completely aligned. That's not the case anymore, following the Annex SL structure. The aim and intended outcome of an occupational health and safety management system is to prevent workplace-related injury and ill health to workers and provide safe and healthy workplaces. And that was the same both for OSAS 18001 and for ISO 45001. ISO 45001 will supersede OSAS 18001, which will be withdrawn. A 3-year migration period has been established from the publication of ISO 45001 back in March 2018, which should have then ended in March 2021. However, this was extended by 6 months until September 2021 due to the COVID pandemic. Within ISO 45002, which is the general guidelines for ISO 45001, well-being is being defined as a positive state of mental, physical and social health. And you can see here some other definitions. In clause 3.8, ill health is defined as identifiable adverse physical or mental condition arising from or made worse by work activities and or work-related situations. And 3.18 defines injury and ill health as an adverse effect on the physical, mental or cognitive condition of a person. So as you can see, the inclusion of mental health and wellbeing is fundamental to the management system documentation, just in the same way as physical safety is now. Next slide, please. So when people think of occupational health and safety, traditionally they thought of physical protection, such as hard hats, safety shoes, high-vis vests. However, mental health and wellbeing in the workplace is becoming more and more widely recognised as an area vital to employee welfare. Mental health initiatives should be an important part of the process that you include in your management system. And many of the requirements of ISO 45001 include areas where mental health can play a key part in its implementation. Next slide, please. The benefits of considering the health and safety of your workplace go far beyond merely complying with the law. Aside from attracting, motivating and retaining staff, there are knock-on benefits for your organisation's productivity, profitability, resilience and customer loyalty. It can also boost your reputation as an ethical organisation, fitting well into your corporate social responsibility policies. It's an internationally recognised standard, ISO 45001:2018, and is a way of managing risks and creating better working conditions. In many industries, having it as a requirement to operate, especially in industries where risks are already well known. However, the importance of health and safety is relevant to all workplaces, especially when risks are not as readily identifiable. Next slide, please. There are a number of areas within ISO 45001 where mental health impacts need to be taken into consideration. ISO 45001 looks at the needs of workers and interested parties. It looks at hazard identification. It asks you to set occupational health and safety objectives and plans. It looks into eliminating hazards and the occupational health and safety risks, and it looks into the management of change. And all of these areas, as we've already spoken about today, have an impact on the positive or negative mental health of your workforce. Next slide, please. One of the first things you need to do when you're implementing your occupational health and safety management system is to identify the needs of your workers and interested parties. This would be where you identify mental health as a key factor in the occupational health and safety of your workforce. And then you can use this information in other processes of the occupational health and safety management system. It is very important, so it should then be incorporated within your occupational health and safety policy. And that sets out the overall goals of your occupational health and safety management system. So for instance, your policy might include the statement, your XYZ company will implement programs to improve employee mental health throughout the organisation. If mental health is one of the key needs of your workers, then you will want to include this in your assessment of your hazards, which is presented by the different processes and functions within your organisation. If you have hazards that are increasing the risk of poor mental health, then you'll want to put controls in place to address those hazards. So for example, since stress can cause poor mental health, if you have a process that is extremely fast-paced and can cause stress in employees who need to ensure that their job is done correctly, you may want to find a way to rotate employees through that job to mitigate that hazard. Next slide, please. So a number of organisations have created case studies to look at the improvements that managing mental health within their organisation has had. And here are just a few of them. So the Grimsby Institute of Higher Education saved £630,000 through reduced sickness absence. They could see that they reduced stress-related absence by 57% by implementing these programmes. And they improved employee engagement. AstraZeneca, who we've all heard a lot about over this past year, showed a cost saving between £500,000 and £700,000 through improved productivity after installing counselling services within their organisation. And their global accident and occupational illness rates reduced by 61%. And these are fabulous figures. Next slide, please. The Foyle Food Group could tell that absenteeism had been reduced by 15%. Their health and safety audit scores in their factories improved by over 20%, and their accident rate reduced by 43%. Parcel Force, their case study showed that sickness absence was reduced by around 33%, accidents by 45%, and an increase in productivity of 12.5%. They invested 2.25 million and could demonstrate a 6 million direct cost savings as a result of that. Next slide, please. So what are the benefits of an occupational health and safety management system to the ISO 45001 standard? Well, it can boost stakeholder confidence and increase trust in your brand because you have it certified by a third party. It increases the productivity within your organisation through implementation of the processes within the standard. In some cases, it can lower insurance costs. It can reduce risks and improve overall managerial oversight. One of the key elements that differs between OSAS 18001 and ISO 45001 is the greater focus on employee engagement, consultation and participation of the employees in the workforce. Gets them thinking more about their own safety and looking after the safety of themselves and of others. It helps to shift from a reactive to a proactive mindset. And it demonstrates your commitment to safety. I love this quote here from Stelios of the EasyJet entrepreneur. If you think safety is expensive, try having an accident. And it's so true. Next slide, please. At SGS, we can offer training solutions as well as the certification side of things through our SGS Academy services. And here are just some of the courses that relate to occupational health and safety, and in particular, mental health and well-being. We can run the mental health first aid courses in partnership with St John's Ambulance. We run an introduction to mental health and well-being for health and safety managers. And we can run managing mental health in the workplace courses, alongside the ISO 45001 courses such as the internal auditor course, the lead auditor course, integrated management system courses, courses specifically for Annex SL or risk-based thinking. And by risk-based thinking here, we're talking about overall business risk-based thinking, not just health and safety hazards and risks. Next slide, please. All training courses are currently being run virtually because of the COVID-19 pandemic. Our virtual training is simple to arrange and it's cost efficient. It can offer more flexibility and ensures the safety and welfare of your learners and of our tutors. We maintain the same quality of delivery as the classroom learning does. And delegates can continue their personal development whilst they're working from home. You'll note here that we're pleased to offer a 20% discount on all of our ISO 45001 training courses to attendees of this webinar. So if this is something you're interested in, please do get in touch. Next slide, please. The SGS Group is a clear global leader and innovator in inspection, verification, assessment and certification services. The group comprises more than 300 affiliated companies, each separately organised and managed in accordance with the laws and local practices of the countries in which it does business. Founded in 1878, SGS is recognised as the global benchmark for the highest standards of expertise and integrity. With more than 70,000 employees worldwide, we operate a network of more than 1,350 offices and laboratories around the world. Since it was established, the SGS Group has remained dedicated to its independence as a guarantee of total impartiality. SGS does not engage in any manufacturing, trading or financial activities which might compromise its independence or neutrality. It is a standard which many countries and organisations have chosen to implement in their commitment to establish a formal and recognised mechanism for managing occupational health and safety. ISO 45001 has been specifically designed to provide such a mechanism and was developed with the requirements of both ISO 9001 and 14001 in mind, thereby allowing ready integration of the management systems and the efficiencies that this can bring, as well as implicitly recognising an organisation's own business needs. It has been appreciated for many years that effective management of occupational health and safety can significantly reduce risk and potentially improve an organisation's profitability and sustainability. It is hoped that this simple approach will cut through some of the fog and management speak that so often overcomplicates things that should be reasonably straightforward. Next slide, please. Our SGS auditors are consistently rated highly by our customers, and the results from our most recent customer satisfaction survey showed that 85% of respondents were very satisfied with the knowledge of our auditors. 86% of respondents were also very satisfied with their auditor communication, confirming that their auditor was clear, open-minded and informative. 90% of the respondents were very satisfied with the timeline for the delivery of their audit and their audit report. And 94% of the respondents felt very satisfied that the site visit was structured to suit their specific operations. Next slide, please. So thank you very much for listening to the presentation. We are sponsoring the Mental Health and Wellness Conference on the 24th of June. So if you want to book early to get your place for £149, you can get that through us until the 22nd of May. It will be a brilliant conference. I am one of the speakers, so I've got to say that. But we look forward to seeing as many of you as possible in person there. And I'll hand back across to Freddie. Thank you.
Brilliant. Thank you very much for that, Kate. That was wonderful. We've had a few questions come in, so I will start right away. Do you think presenteeism is about stigma if employees don't want to share their bad mental health?
Yes, I think that is a really significant part of it. And I think that a lot of that comes from where we're needing to change the management structure within an organisation so that you can lead by example through the management in your company, so that your employees are not feeling like they have to turn up regardless of how they're feeling. This has come to the fore a lot more over this last year, I think, as well, particularly because of the COVID pandemic, where we're looking for employees to take more sort of cognizance, if you like, of their own mental health and well-being as well as their physical well-being, and not be turning up if there is any chance that they could be spreading what they have to their other colleagues.
Yeah. We've got another question here. Would well-being be the subject of all ISO 45001 audits?
It will be incorporated within your ISO 45001 audits. As we spoke about through the slides as we've been going through there, you can see that it is inherent, it is involved in so many different areas of the ISO 45001 management system. So where previously it might have been audits only looked at the physical risks that you were managing, they will now also look at the risks that you are recording in relation to the mental health and well-being of your employees and how you are managing and helping to follow the hierarchy of controls to reduce and eliminate those risks.
Fantastic. How would you manage the issues raised if mental health is an issue?
That is a very subjective question because it is very dependent on the issue that is being raised. And it is very subjective as to the individual that has the issue itself. It's something that you as an organisation will need to take seriously and something that you should have processes in place to deal with according to the type of issue that's being raised.
Thank you very much. I've heard of mental health first aiders. Are you able to explain what they do?
So a mental health first aid is a training programme that teaches members of the public how to help a person who's developing a mental health problem or experiencing a worsening of an existing mental health problem or is in a mental health crisis. Like traditional first aid courses, mental health first aid does not teach people to treat or diagnose mental health. Instead, the training teaches people how to offer initial support until appropriate professional help can be received or until the crisis has been resolved.
Beautiful. How long does it take to write and implement a management system?
Oh, that's a good question. It can take anywhere, if you're writing it completely from scratch, it can take anywhere from 6 months to a year or longer, depending on the support, knowledge, experience that you have access to, either directly within your company or if you're using external support for that.
We've got another one about management systems. Should we be considering out of the box type management systems? And if not, why?
Okay, so out of the box type management systems were never ideal. The Annex SL format and the structure of the ISO standards now, the 9001 2015, the 14001 2015, and the 45001 2018, all very similar in this respect. They are designed to be bespoke for your particular organisation. Therefore, an off-the-shelf type of management system that somebody has created elsewhere will not necessarily fit you as an organisation. So you should have at least some means of tailoring that to your organisation, taking ownership of it and making it completely bespoke to what you need it to do for you.
What is the validity of an ISO 45001 certificate?
Okay, so by this, do we mean the time and duration that it's valid for?
I think so, yeah.
Yeah, so okay, so for that then, an ISO 45001 certification would run for 3 years if you're using a UCAS accredited certification body, which in the UK I would always recommend you use a UCAS accredited certification body, because UCAS then assess that certification body in the same way, to the same sort of standards that you are being assessed. They assess our competence, they assess our processes and procedures, and they assess how we do things on an annual basis and on a regular witnessed audit basis. The validity is also only relevant for your 45001 certification, provided you maintain your surveillance visits over that 3-year cycle, be they annual surveillance visits or 6 monthly surveillance visits, depending on how your certification contract has been set up.
Okay. And last question. I've had OSAS 18001 certification before. Can I now just go and obtain the ISO 45001?
If your OSAS 18001 certification is still valid, so you still have a live certificate, which could be valid up till the end of September this year, then you can carry out a migration visit or migration audit to ISO 45001. That can either be done as part of your surveillance visit if you have that before the deadline of the 30th of September, or your recertification visit if that's coming up before the 30th of September, or it can be done as a standalone visit. Please come and speak to ourselves or speak to your own certification body if you're in that situation. If your OSAS certification has expired, you would need to be starting again from ISO 45001. I hope that helps.
Certainly does. I think we're pretty much out of questions now. So thank you very much for that, Kate. You've been really, really helpful today. Just a reminder, we will be emailing out a copy of the webinar and the slides. So that will be going out. I imagine that'll be next week now. If you do have any further questions you want to contact us, you can email us on uk.nowisthetime@sgs.com, or you can give us a call on 01276 697 715. We're on all the usual social media channels, LinkedIn, Twitter, Facebook. And yeah, just don't forget, we are sponsoring the Mental Health and Wellness Conference on the 24th of June. So the link will be included in that email that we send out next week. So you can book your early bird price of $149. So thank you all once again for joining today. It's been wonderful to have you. Thank you, Kate, and I hope you can all speak to you soon. Take care. Bye-bye.